Okay, great. So hello everyone and welcome to this talk. This session is all about digital cancer care and how technology can be used to empower patients beyond the four walls of the hospital. Today I'm joined by Paul Landau, CEO and founder of digital cancer care company Careology. I'm going to be asking Paul a few questions about Careology and how they're helping to transform digital cancer care. So let's get stuck in. So Paul, it'd be great to find out a little bit more about your background in health tech and why you started Careology.
Yeah, sure. So great to be here and thanks for the opportunity, Kat. So I've worked in the health tech space for getting on for 20 years now. Prior to starting Careology, I ran a company called Fitbug that really was the pioneer of the wearable technology space. It was a company which I formed way back in 2005, which seems like a lifetime ago now. But it was very much all looking at how we could use great software, great user experiences and devices to help people achieve health outcomes that were important to them. So it was very different to where we are today at Careology. It was much more aimed at the health and wellness end of the spectrum. But we learned a huge amount about how you can get people to engage with their own health and how you can use data and insight to help people take more accountability of their own health, and some really great techniques for how you motivate and incentivize people to achieve a health outcome that's important to them. And so, kind of jumping forward. Sorry, Kat, did you want to come in there?
I was just going to ask, yeah. So what does Careology do now, and what are the key challenges there that you're trying to solve?
Yeah, so just carrying on that story to get to answering that key question. So I ran that business for 10 years. Then, long story short, my wife was diagnosed with cancer. Initially went through treatment back in 2016, but then had a recurrence in 2019, and ultimately went through lots of chemotherapy and then a stem cell transplant. So an incredibly grueling treatment pathway. But for me, as someone who'd worked in the health tech space and was supporting a loved one through such a difficult time, it really became so clear at what a huge gap in the market there was for really effective digital tools that could better support patients going through such a daunting diagnosis, could also better support people in the boots that I was in, acting as a caregiver, which is obviously incredibly scary place to be as well, looking after someone suffering so badly with so many toxicities, and everyone is obviously incredibly concerned and scared. So caregivers need supporting too. And then obviously the clinical team as well. And what really struck me, Kat, was how cancer is almost the inverse of most other healthcare conditions. And what I mean by that is that treatment is timed, that you have to be strong enough and your bloods have to have recovered well enough to be able to tolerate the next dose of treatment, especially with chemotherapy, which is what my wife's main treatment plan entailed. So you go to hospital when you're well, and you actually come home to be sick. So you end up with patients at home suffering all the nasty side effects and toxicities of treatment, really making quite clinical judgment calls as to when they pick up the phone and let the clinical team know if there's something that is going wrong or a side effect they're not tolerating. And obvious watch outs were things like fevers that can be an early sign of an infection. And if you are going through, especially chemotherapy, your white blood count can become depleted. So you become really susceptible and unable to fend off infections. So the early sign of a fever, which could allow you to intervene early if that person has an infection, can really help that person stop deteriorating quickly, because that can turn into sepsis, which can become life-threatening really very fast. So the whole concept was centered around how do we better equip a patient when they're at home, but then how do we connect that person to that care network? So whether that's friends and family, helping them have better insight and better advice to play that role better, but critically removing a lot of the onus on that patient to be making these clinical judgment calls and making sure that the clinical team, for the first time ever, could extend their reach beyond the four walls of the hospital. And they now, using Careology, are able to say, Paul is at home, his temperature's spiked or is trending upwards. We can now intervene, work proactively, and avoid that complication becoming more advanced, more complex, more expensive to treat. So essentially, answering your question, what Careology has now built over the last few years is what we call a digital cancer care platform that better equips patients, connects them to caregivers and the clinical team. And then through Careology Professional, which is the enterprise kind of piece of software, healthcare teams are now able to understand how their entire population of patients are when they're at home, have better insight, better data to be able to work proactively, work more effectively. When the patient comes in for a consultation, be able to pull up the data and actually understand how they're tolerating their treatment. So, it's starting to deliver a huge variety of benefits for all the different stakeholders in a cancer pathway.
That's amazing. Thanks, Paul. And could you just describe a little bit about where Careology is being used today and kind of how that it's specifically helping in those cancer spaces?
Yeah, absolutely. So we see three main channels for Careology. The main focus initially was very focused around healthcare providers. So working both with the NHS and with the private sector as well, to tackle some of the challenges which I just mentioned. So really good examples of where the platform is now deployed is say Guy's and St Thomas's, where we have a really exciting collaboration with Guy's Cancer Centre here in London, all focused around how we can better support the clinical team and the patient. But that relationship is actually has key elements around co-development within it. So as part of the collaboration, we're now really seeing Guy's as an extension of the Careology team, and they are really helping us push the boundaries and continue to keep innovating. And the relationship is really allowing us and our product team to understand what are the needs of a large, sophisticated cancer centre, both clinically and operationally as well. What are the challenges that they face day to day that digital has a role to play? So Guy's is a really exciting relationship. The Royal Marsden is another one where we actually deployed with the Royal Marsden earlier this year, working with teenagers and young adults, which is obviously a demographic with very unique needs. Clearly, any cancer diagnosis is daunting, but being diagnosed as a teenager or a young adult has exceptional challenges. So a key part of the relationship with the Royal Marsden is looking at supportive care and how we can use the Careology platform to better support patients mentally and physically through being able to surface personalized content that can support those patients. And then if I switch to, say, a second channel, we're working in the payer space. So we actually signed an agreement earlier this year with Aviva. Again, really interesting piece of work in the private sector, but looking at how we can support members of an insurance policy to also better navigate and feel more confident and safe as they're going through treatment. And the third channel for us is the pharma space. And we're doing some really interesting work with a very large pharma company actually in Canada around a patient support program and looking at how we can better support patients on particular drugs to also make sure they're adhering, persisting properly with those medications. So a real assortment of different clients across provider, payer, and the pharma sectors.
And you talked a little bit earlier about that personalised support for patients. Could you just detail a little bit more about how Careology's technology is better supporting those patients?
Yeah, so I think going back to the beginning of the conversation, when someone is first diagnosed with cancer and starts getting into their treatment, there is just so much for somebody to understand, get their head around. It's such a daunting diagnosis, obviously. When you talk to clinicians, I know that Dr. Kazmi at Guy's and St Thomas's often talks about how as a major sophisticated trust, they feel they're giving their patients a lot of information about their diagnosis. but actually patients often report they haven't had enough information. And I think it's probably not about the quantum of information patients get. It's actually when you're in that shock and awe stage of getting that diagnosis, it's very hard to assimilate and get your head around, your treatment plan and what lies ahead. So really what Careology is able to do is help us right from the point of diagnosis, help people understand that diagnosis. But then as they get into treatment, again, there's lots you need to manage on a day-to-day basis. So whether that is accurately logging your side effects from treatment and being aware of when you should be picking up the phone and letting somebody know about an issue that you may not be tolerating well. Medication management, we know people often really struggle with. People are often on such a huge cocktail of different drugs with different doses on different days, and people really struggle to get that right. And we often hear about people who had built elaborate spreadsheets to be able to tick off what they've taken. Now with Careology, you get a push reminder when the next dose of your drug is due. So we're prompting you, but you can check it off in the app so you have a complete record and you don't forget, did I actually take it? Because we know people often really suffer with what's called chemo brain. You forget what you kind of just done. Keeping your treatment journal is a really important thing that patients are asked to do. So you're recording how you've been feeling, how you've been tolerating your treatment. So when you come in for a consultation, you do have an accurate picture of how you've been. So there's lots of kind of the nuts and bolts tools of things that you just need to manage day to day, which can be daunting. But on top of that, what we've really tried to introduce, I mentioned before the term supportive care. It's not just the physical, it's also the emotional element of your diagnosis, and making sure that people have the right information at the right time in terms of content. That could be recipes, articles, tips. So again, through Careology, we can now surface that right information at the right time, some of which comes from our own authors, and we do write some content internally, but then also through charity relationships. So a key relationship for us is with Macmillan, where we've recently worked with Macmillan on the ability to pull Macmillan content into Careology, which is just fantastic. So instead of having to pick up pamphlets and waiting rooms, there's now all that information within the Careology user experience. So it's a really rich, helpful user experience for patients, designed in a way which is really consumerized. And one of the things we feel very passionate about is building a tool to support people through a difficult time, but in a way which feels really consumerized. You already know that you're sick. You don't need the technology that you used to be one more thing to be kind of stigmatizing or very dry. So from the brand that we built and the user experience that we built, we wanted to create a platform that feels really engaging, really holistic, and is genuinely something that patients want to engage with and use as they're navigating their way through the complexities of a cancer diagnosis.
That's really, really different. And you talked earlier about as well kind of connecting with caregivers and also with their clinicians as well. Could you kind of explain a little bit more about the clinician side of Careology?
Yeah, so on the clinical side, I mentioned earlier on that clinical teams are often having to work reactively. Unless someone picks up the phone and lets the nursing team or the triage line know that there's an issue, of course the clinical team can't know about that under traditional ways of working. So now through Careology Professional, as I mentioned before, the idea is how do we knock down the four walls to the hospital and really allow the clinical team to extend their reach right into someone's home and have that data and insight for the first time to be able to spot that this person may have a problem, or they haven't taken their meds yet this morning and they really needed to have taken that particular drug, for example. So through Careology Professional, all of that information that we're helping the patient manage at home can then be made available back to the clinical team. So it's helping clinicians work more proactively. I think in turn that increases clinical safety because they're able to look after those patients wherever they may be. I think a really key area is operationally, how can we help clinical teams work more effectively and efficiently? You know, Kat, we've all read over the last few years about the cancer backlog and shortage of capacity in the system. And this was a problem pre-COVID. You know, the issues around waiting times and getting people into treatment is something which predates COVID. But over the last few years, the problem has just got worse. You know, we've got shortages in the cancer workforce. There's just not enough nurses and doctors. We're having more people, unfortunately, diagnosed later because their screens, routine screening has been delayed for a lot of people. So the opportunity to use digital to improve the way that clinical practices can work with better data and better insight offers enormous benefits to be able to reduce the time that consultations take because you've got better insight, or to be able to reduce the number of consultations that someone might actually need, because you can potentially see that that person's absolutely fine. They're doing everything they're meant to have done. They're keeping on top of everything. So clinical capacity is another very big area. But then, you know, if we can intervene early and reduce unnecessary admissions or visits to the emergency room, you know, A&E, there's huge benefits there as well in terms of reduced complexity, reduced cost. And, you know, the data shows that over the course of, say, a typical 6-month treatment period, on average, patients will have 2 acute admissions over that 6-month period. And often those are entirely preventable with things that could have been identified earlier. So, you know, that's another really good example of where being able to use digital to identify complexities early can pay enormous dividends in terms of identifying things early, avoiding those acute admissions that can push back treatment and have enormous knock-ons. So lots of different impact areas, whilst making sure that clinical teams just have better data and better insight to support patients in the way that they'd really like to be able to.
And are there any other kind of benefits for the sector as a whole? You've kind of mentioned some of those clinical and operational outcomes, but anything else that you feel that technology in particular is designed to be able to kind of help overcome?
Well, I think, you know, I often make the point that if you look at how we all live our lives today, digital touches pretty much every point of how we live, from how we shop, how we bank, how we book holidays. It doesn't really matter. You know, patients, consumers now expect digital to play a part in their lives. And I don't think that healthcare is any different. Just because you're unwell as an individual, you still want that convenience and that support of being able to use technology in your life. And we've certainly done you know, surveys and research with patients, and that's certainly reflected that people now expect digital to play a part in their healthcare. So, you know, when we look at those overall kind of benefit buckets, they do really span the patient and how we can deliver a better patient experience, helping that person feel more supported, more in control, and also less likely to have to travel all the time for appointments, which in some cases are superfluous or just weren't required, or perhaps the patient or their caregiver could manage for themselves to improve self-care at home. And that we can see that's happening. I mentioned before kind of clinical workflows, you know, things like, I don't know, consent is a really good example of a traditional clinical workflow that will often take 2 or 3 appointments by a consultant to be able to get that person from the point of diagnosis to understand their treatment plan, understand the risks involved from the treatment they're having, and then finally come in again to put pen to paper and sign the consent forms. Now, again, that's another really good example where you could digitize that process, and therefore speeding up the time to start treatment is possible, improving patient experience, but also potentially freeing up 1 or 2 consultant appointments that could be used helping to, you know, see additional patients if we're trying to clear a backlog and get more throughput in the system. So, you know, there's so many different opportunities for digital to transform processes which in many respects have been the same for decades and are just done in a certain way because it's how it's always been done. But as I say, there's huge opportunities for digital to streamline a lot of these processes and add benefits to all the different stakeholders in the pathway.
And what do you think will be the biggest challenges in doing that, in digitalising the cancer pathway?
Look, I think that we're seeing a huge groundswell of interest in these sorts of solutions. And as I say, there's no doubt that COVID was an accelerant for the healthcare sector to adopt technology. I think there's no doubt that the healthcare sector is a conservative space. It hasn't been one of the early adopters of digital technology, but I think what COVID meant was even the most conservative of clinicians ended up embracing digital. And so we've really seen a huge change over the last 12, 18 months of providers recognizing the benefits that digital technology can provide. So I think the appetite is there. There are still challenges around funding, especially in the NHS and having access to the money to pay for technology and digital solutions. But, we are certainly seeing at a central government level, there is far more dialogue and conversation around properly funding digital innovation in healthcare. So it's coming, but to be honest, I think it needs to happen faster. And given the challenges that, I've talked about at length, I really think there needs to be urgency about properly funding digital initiatives, not just in cancer care, but across the NHS, because these sorts of solutions really can deliver very important benefits, to the system as a whole. So that's key, and it is still a challenge. And I think another really hot topic, which comes up in lots of conversations, is around interoperability. And what that means in layperson's terms is how we can make sure that technology solutions coming from innovative sectors of digital healthcare, like Careology, our platforms can easily talk to the electronic health record systems that are used, in healthcare departments, in clinic. And that technology definitely exists. We are able to talk to electronic health record systems, but you'll also appreciate, if you look at the NHS as a whole, there's a mishmash of different systems and different trusts up and down the country. So that is a challenge. But, one by one, we are making that integration happen and starting to talk to the main systems providers in the cancer centres that we're working with. So not insurmountable again, but I think I would say funding and integration are really big areas of focus that we have to be able to challenge as a healthcare system.
Thanks, Paul. And what's next for Careology?
Oh, deep breath there. Well, I think, we have an enormous product roadmap and huge ambitions for where the company can go and the product can go. And I think going back to the clients that we're working with, it's an ongoing dialogue with all of our customers to understand what are their burning issues, what are their needs. And, I mentioned before, say the relationship with Guy's and St Thomas's is such a good example of a very large, very sophisticated NHS cancer centre, where the collaborative nature of that relationship is really helping us understand what are the next challenges that digital could help them address, as an example. And that's true of all of our clients. So Nuffield Health is a deployment we've learned a huge amount from. Lloyd's Pharmacy Clinical Home Care is another. So I think what I'm trying to say is, proximity to market, having lots of ongoing conversations with all of our end users really steers that roadmap and helps us prioritize from a very big roadmap what should be done next. But I think, we are certainly looking at how we can expand Careology to assist in more areas of a cancer pathway. So we've been very focused to date on the treatment stage, but we know, for example, survivorship is a really big unmet need for a lot of people. When people finish cancer treatment, fortunately these days, more and more people go into remission and having really good outcomes. But that's not to say that person doesn't have, ongoing needs for a long period of time. How do we better support people that are now kind of seen far more as a chronic condition that needs managing for many years? So that's a really nice example of where, as a business, we're looking at how we extend our reach and support people for longer. But I think the one other area which won't surprise you is around a very topical area of AI and data, and how we can use that data and insight to better support clinical teams. And I don't have any aspirations for a minute to say, well, technology could replace clinicians. I don't think it can. But I think we can certainly use data and insight and AI to be able to help clinicians do their job better. How can we help, say, prioritize and personalize the user experience, predict issues that might be coming down the track, for example. So data is also another really big focus for us going forward.
Well, that's been really interesting talk. Thank you so much, Paul. Great to hear about what Careology is up to. It sounds like you guys are going to be really busy over the next few years, I'm sure. Well, thank you everybody for joining today's session. We hope you found it really useful. And if you want to find out more about Careology, you can follow them on social media or go to their website, careology.health.
Thank you very much, Kat. Been great talking to you.
Thanks, Paul.